All right, guys, we got Dr. Stoker about to enter the live. There he is.
Hey Jordan, how are you?
I'm good. You guys good? Can you hear me okay?
I can hear you loud and clear. You're looking good.
All
Looks like
right,
you're staying in
perfect.
shape.
I'm doing my best. This COVID thing is, it's been a challenge for everyone, I'm sure.
Oh yeah, I'm sure for you in particular. What'd you do with the limited gym access? I guess you had to make it happen at home for a while, huh?
Yeah, I mean, I got some weights here and some adjustable dumbbells, stuff like that. And then I have a buddy who has a great setup in his garage, so I just go in there and train with him, and we're still getting it done.
Yeah,
Can't
we gotta
it,
find a way.
exactly. It's a lifestyle, so we got to keep it moving. And I see that you're still doing great, looking awesome.
Well, thank you. Yeah, I did have a long day of surgery today, so I'm glad you think I still look awesome. It's funny. I have two different major parts to my job. One is meeting and talking to patients and seeing them in follow up. The other is actually operating in surgery. They're really two different mindsets. I'm kind
Yeah,
of in surgery mindset at the moment, but I'm about to switch into the patient consultation and follow up mode. So
totally. Well, you're an expert in both, so I think
thank you,
the
thank you,
results speak for themselves. So,
thank you.
um, for everyone who's new here, just I want you guys to meet Dr. Stoker. He's awesome. He and I go way back. He did an incredible job on my surgery for the excess skin removal. So we're going to talk about that, and I'm just really excited. He's the man.
Well, there are a lot of things that stand out to me about your case. I mean, I do a lot of really dramatic things, and even among those cases, yours really stands out for a couple of reasons. One is how I think you had a really big problem to begin
Hmm.
with. Uh,
Absolutely.
you overcame a lot to lose a ton of weight, and then I think we met, and you came back like a year and a half later after losing even more weight and getting more fit. So
Hmm.
it got me pretty fired up to feel like, okay, you did the most that you can do on your own, uh, and you needed some help. Otherwise, you're going to be left with this unthinkable amount of excess skin. And it's kind of a big and somewhat risky case, honestly. But I felt so good about helping you with it. And I think right around that time, we were finishing up that TV show, Extreme Makeover Weight Loss Edition.
Hmm.
And so I was in the mode where I was doing a lot of really big, really dramatic cases. So yours wasn't as big as some of those, but I think it was even more inspirational because of how much you had overcome to get there, and you were so fit underneath all of that loose skin. But
Thank you.
I think about every time I see you in on Instagram or wherever. Usually it's winning some kind of competition or lifting some absurd amount of weight that bends the bar when you lift it. And it makes me feel really proud of you because, it's a collaborative effort, what I do. It's not all about me. It's not all
Hmm.
about you. When we sign up for surgery, it's you and me together. We have to survive together to make the right decisions that are going to enhance your life. I need you to pay attention to what I said to
Hmm.
do. I need you to communicate really well with me, and you did everything exactly right. And then once we removed that skin, you took it to the next level, and it's very impressive. So I'm psyched that other people are tuning in to hear your story, and frankly, I'd like to hear it more
Yeah.
also about. I think we met around 2012 from what I remember, but
Hmm.
would you mind just for people who are tuning in right now, let's give us a little bit of perspective. Where did you start out? What happened? What were the catalysts in your life to bring you into my office? How did you hear about me? And
Yeah.
let's hear your story.
Yeah, thank you. So, I was always overweight, like my whole life. I was just a big kid growing up. And by the time I was 13, I was nearly 300 pounds. So I had a problem with food. And then, unfortunately, my mom passed away when I was almost 14. And I just went into a downward spiral. I just like couldn't deal with the pain. And food was like my outlet, it was my drug.
Yeah.
And that spiral continued and continued for many years to where I got to weighing over 421 pounds. And when I would go to the other types of doctors, like just internists, which I avoided also. You know, you don't go around them as much when you're that
Not
unhealthy.
good news. They're not going to tell you, great job, Jordan.
Right,
Yeah.
exactly. So, you know, they would always say you're not going to make it till 30. And, you know, so I just was in a really bad place. And in 2008, I had a wake up call when I was hit head on by a drunk driver when I was driving home. And my airbag was just reconnected, you know, a few hours before that crash. So it showed me, I was like, okay, there's a reason. I got to get my life together. I got to do something. So that was what kind of set me off on this path, which I had no idea would lead me to any of what I've done. But I knew I just had to get healthy. I knew I had to just not be over 421 pounds, slowly getting worse. So I started walking with my dog. See the hat? A big dog fan. And changing my nutrition. And just with that, I lost over 100 pounds in about a year. And then I joined a gym. I fell in love with that.
Jordan, may I ask you, I mean, obviously you have a ton of muscle now. Were you always kind of muscular underneath that fat, or were you a skinny guy without a lot of muscle beforehand?
I really had no muscle. You know, when I joined the gym, I could barely bench press the bar empty.
Wow.
So it took a lot, you know, and I always wanted to do better. So once I lost all the weight, then I started kind of shifting to focusing on getting stronger. But, you know, I had all this extra skin, which I didn't know would be an issue. You know, back when I was kind of doing this, Instagram wasn't really around and people weren't like putting it out there. Like, look, if you lose 200 pounds, you're going to have all this skin. So I had it and I was like, all right, I'm going to try to build muscle and fill it out, which, as we know, there's no way to fill out that much skin. I tried.
You tried really hard, but it's,
yeah, so it's not possible. Which led me to start researching, okay, you know, there was no other option. And once I embraced that, when I realized there's no amount of exercise or diet or changes that I could do myself that will get rid of that skin, I said, okay, I need to enlist the help of a professional. And I started looking at doctors, and then, you know, I consulted with several, but when I came across your office and saw your results and spoke to you, I was like, all right, this is what I have to do. And, you know, it was hard to let go of that control because I was like in control of losing the weight, building the muscle. But I'm like, okay, Dr. Stoger knows what he's doing and he's going to get me a good result. So then after we met, I went into like overdrive and worked even harder, you know, leading up to the surgery date, which was the day after Christmas in 2013. And, you know, so it was just like a process. I treated it like a competition. I'm like, I got to come into, you know, your office in the best shape I can because we're working together to get the best result that we can get.
Yeah.
But, you know, and for anyone who's watching, like, I know it's tough to, like, you know, kind of give up that control of your body, but sometimes you have to, and you have to get someone who really is the best. And I mean, I knew right away, I got to say, like, like this is the guy.
So you must have been, obviously you were very nervous. Everybody is nervous going into surgery, especially something like this. You knew that your case was not a regular case, right? You could look at 100 tummy tucks online. None of them were as big as yours was about to be. And not many chests looked like yours either. And the combination, you knew that it was a special situation, right?
Correct. Yeah. And it was extreme.
Yeah. So that's, you know, something that I'm curious what your reaction was, because, you know, I confront that every day with patients who are very fearful about what they're having to do. And what I tell them is, you know, you really want to educate yourself on the pros and the cons, and make sure that you have really the best professional taking care of you. So really research to find that best professional and to listen carefully to them and get multiple opinions also. Your case was so difficult, probably not that many surgeons would even really want to do that case, I think, in some cases, because a lot can go wrong. But for me, that gets me pretty excited, actually, as an opportunity to do something significant.
Yeah. Yeah.
Tell me about, as you were, like, what it was like for you in the consultation when we met. Because I know this went on for like a year and a half the first time we met, and I know you saw other doctors. What were the things that kind of put you at ease in your interactions with me that caused you to choose me as your surgeon?
You know, I went to a lot of different doctors to get different opinions to see what, methods they wanted to do, or if they wanted to break it up, or all this different stuff. I remember one was like two separate doctors, and one's like, I'll do the upper, he'll do the lower at the same time. And I just never got a really good feeling about any of those, kind of propositions. And when I spoke to you, you were confident, and you're like, I looked at your book and I saw the work you were doing, and I knew that you were capable to take on this extreme case, more so than anyone else who I had met with, even if they told me that they were. I just felt like, okay, this is something I want to do once, right? And for anyone who's doing any type of surgery like this, especially because I know a lot of folks who've had to do revisions and things like that, which I understand, but I really did not want to go down that road.
Right.
So I was like, I waited, right? It was like about a year, I think a year and a half from when I first met with you to when I got on the table, so to speak. But I think it was really worth it because you made me feel confident that as long as I do my job, you're going to do your job, and together it's going to come out really well.
That last part is key, by the way. Let me just emphasize that to everybody out there. Like, you want to do your research, find the right doctor, make sure you have a really good professional, but then listen carefully and don't leave it up to just that doctor to do all the work, right? You were exceptional in burning off the fat, building muscle, doing everything I asked and more to prepare yourself. So you were proactive. You took control of it instead of just passively handing it off to somebody else and hoping for the best. That may be okay in some situations, but when the stakes go up, the case is bigger, it's harder. You know it. There are not that many cases that look as extreme as yours anywhere. That got me pretty fired up too. And I think it's human nature when those around you are working really hard and contributing, you can't help but want to do the same yourself. I'm sure I would have tried hard anyway, but I certainly felt great about all the work that you put in to get there, and I thought it was going to be a special opportunity to make a big difference in your life. So.
Oh yeah, and I gotta say, it was something that it weighed so heavily on me, having that excess skin, and especially, I know it's kind of like a different time now, which is good. Like I have some buddies, they might even be watching, who have the skin and they like flaunt it, and they're like, look, I did the work to get to here, which I totally get and I respect, but it's hard mentally when you've worked so hard to lose all this weight and turn your entire health and life around. And especially in my case, I was working, it's almost like an art of the past, but I was a personal trainer, and I was in there, demonstrating exercises to people, jumping around, and I would have this excess skin kind of flopping and making noises, and it was just tough.
I believe, I've seen this a lot. I think this was your case too. Correct me if I'm wrong, but prior to the skin removal surgery that I did with you, if you were doing push-ups, your chest skin, your breasts, and your abdominal skin would stay on the floor. Even though you're going up and down, the skin wouldn't move off the floor, just the rest of your muscles and body, I believe. Right. That's not good. That's not optimal for sure if you're trying to do a workout.
Right.
Another point I wanted to make is about how you said there's a certain pride that some people have when they lose weight and they have extra skin and they just own it. And that's great too, because it's not about shaming. It's not that we all have to look like the same person and they have the ideal body. But, we each have our own insecurities or things that we wish we could change about ourselves. None of us are perfect. And it's nice if we're able to offer alternatives to those who are really bothered about them. The last thing I would want to do is imply that everybody needs to do the surgery that you did as soon as they lose weight. That's not the case. But I think yours is a pretty extreme case, and it was understandable how you would feel better if you didn't have that extra skin hanging off of you. And
yeah.
What was it like when you were growing up? If you went to, let's say you must have gone to the beach with your friends or the pool with your family or something. There must have been a lot of public situations where growing up as an overweight kid, it was inescapable that you were going to look different, and probably a lot of people would stare at you and potentially make you feel uncomfortable. Did you experience any of that in your youth?
Absolutely. And, you know, it was really challenging. I remember I got to the point where even growing up, like, you know, we had a pool at the house and I would wear a shirt in my own pool when there's just nobody even around because I felt so badly about, you know, my weight and my shape. And I do think that actually, like, losing the weight, it did really help me kind of turn that around to where even before I had the surgery, you know, I would go and hike and I would have the skin just kind of flapping around, and I would go on the beach and I would take off my shirt and people probably were still staring, but I had that, you know, at that point I was just like, I did the work. But actually, you know, I do remember just growing up, it was really tough. You know, I never wanted to do, like, you know, if they did shirts versus skins or something, like, I'm on shirts, and, you know, if we went to the beach, I would just be kind of miserable because I'd have my shirt on, and it's tough.
And you know what happens as a consequence of that, I believe, in a lot of cases, is that patient or of somebody who works really hard to lose the weight and then it still feels embarrassed about their appearance or depressed about their appearance, there's a much higher recurrence rate of returning to that obese or you know, extreme overweight situation if you don't feel good about yourself and want to keep it. So I think there is a role for that in patients who are, if you're bothered about your appearance after this and you're able to do the surgery, in my personal experience, if we work together, do some significant surgery, help you to look a whole lot better, it is highly unlikely you're going to regress and gain all that weight afterwards. And that is significant, and I think a really positive thing about plastic surgery, that if you have the confidence to deal with skin hanging off of you and it becomes kind of a, you know, a badge of pride that you want to wear, then that's cool. But I think that's the exception to the rule for at least the people who come to me. And so there is some therapeutic benefit. And how have you, I mean, this is not only, I mean, obviously taking care of yourself is a big time passion now. What was it like? How did it make you feel once you got healed up from the surgery? Because you were working out hard up until surgery. Then you had to heal for, I don't know, probably a month or two at least before. I must have said something like, please don't go out and squat 600 pounds for those few weeks. I mean, it's,
I remember that voice.
How did you stay motivated after that then? Or like, what did that do to your motivation?
You know, it was a really interesting time between getting the surgery and finally getting back into like my normal routine as far as fitness. It was a blessing in disguise. I kind of had some time to slow down a little and focus more on walking. You know, when you told me it's okay to break a sweat, I walked a little faster, walked a little further, but it was kind of like starting from the ground up, which is what we have to do, you know, just with anything. I think that, you know, people see fitness and health and they want to just go like all the way in right away. And this was like a perfect example of you have to ramp up gradually. And it was tough because I remember I was squatting like really heavy, like a couple days out from the surgery. And then when I finally got back in the gym, I squatted the barbell empty with no weights, and it was challenging. And I had to kind of start back from scratch and then build my way back up. But it was actually kind of like a cool project because I knew what my body was capable of. And now I didn't have the skin hanging off, and it felt so freeing to be able to do push-ups and burpees, even though everyone hates them, and not have the skin, you know, flopping around.
Yeah.
It was life-changing, really.
Let's see, we've got a comment. I didn't see the comment.
What type of surgery you have for those weight removal?
Oh.
Yeah, we had one inquiry, which I think is a great topic, is what did we actually do for you? Because it was not the typical case. Should we tell them about the details or about, you know, from my perspective and yours? What do you think?
Absolutely.
So what I saw is that you had a tremendous amount of excess skin on your torso. The abdomen is the most common area to see a lot of excess skin. You had an extreme amount on your abdomen, extending all the way down into your thighs and laterally on the sides. But that I'm very used to. What was, I thought, exceptional is the way that your chest skin hung down. I mean, it was really droopy. And especially after you lost that last 30 pounds, with the difference between 2012 and 2013 when I saw you, there was no hope of doing anything minimal to your chest and getting a good result. So we made the decision to go with free nipple grafts, which basically means that there are mastectomies that we perform for cancer where you remove the breast. I did about 10 times that much to you, where we removed all of the breast tissue, all of the skin hanging off of you, took your nipples off to use essentially grafts, created a new bed. And what's really fascinating when we do this type of surgery is I'm actually looking at your anatomy on the underside. So for somebody like you really look like a superhero when your skin is lifted up, because I'm looking right at those muscles, which are about that thick compared to a normal person being that thick. And then we had to tailor that skin. I was thinking to myself, obviously, how can I get the best possible result? In particular, working around as your pectoralis major, blends with your serratus on the side. How can I sculpt you, or really it's more like tailoring at that point, to tailor your new skin to fit your new body, which is a very extreme body. And when we pull so much on the chest and pull so much on the abdomen, there's a lot of movement of your skin in all different directions. So thank goodness I've done many, many big cases before yours, and I think I got the location of those incisions just right, which is super key. It's not only, there's so many elements to getting an exceptional result in a case like yours, and it all clicked. We got it exactly right. We didn't even do a revision. It was just like we removed square yards of skin from your body and reset your nipple position into the perfect position. It was a big case. The other thing that was really critical is whether or not we flip you over and try to do a circumferential body lift or not. That was easy for me. You were way too big for me to try to flip you over, in one operation. That was not something I wanted to do. So what I did is worked on the front of you as far as I could go, all the way to the table on your upper body, and then the same thing on the lower body. And that's enough for you or for me for one day. But I think we got it done, so you didn't even need to do the back side of you. So I had two assistants pulling you from the sides to give me enough exposure that I could get that extra 10 or 15% done. We went the extra mile for you, probably because you went the extra mile to optimize yourself for the surgery. And it made all the difference, right? One and done. We did it. Super exciting.
Yeah.
I
think it came out amazing.
Jordan, I don't know if the people who've joined us have even seen your before and after pictures yet in surgery, but I definitely would encourage them. I think they're linked to the story here. You can find them on our Instagram, certainly on our website too. It's really shocking, I think, to see your before and after. Like when you're leaning over, when you're like scrunching your abdominal skin, to give a little bit of an appreciation of what it might have felt like to be in your shoes. Probably didn't feel that good back then, but it feels good now.
Yeah, I mean, it feels incredible. And, so it was just like such a big shift for me. I remember the first time I saw myself in the mirror in your office, I legit almost fainted because I was so like overwhelmed with emotion. And I don't want to say I'm a tough guy, but I'm able to deal with a lot. But when I like saw that part of me that was kind of weighing me down was just gone, and that it was, my hard work was like able to be seen, it really was monumental for me. And it really, I do think, like what you said, where this kind of thing can really help to keep someone on this path. I mean, it's
You're
like
a good example.
you can never go back. Once you've done all this work and you've done all this effort and time and things that, putting your blood, sweat, and tears in it, having a team, having someone else help to get to where we want to be, it's like I can't even imagine going back. And when I look at those photos, like the ones, I'd never taken any photos like leaning over like the ones you had me take, because it was just such a unflattering angle.
You don't want to think about it. You just want to close your eyes and not think about it. but it
Yeah.
was there.
And you know, when I see that, like it really exposes like what a massive difference it made. Um, Doing that, you know, I think so. I saw someone had asked like what the procedures are called, and if I remember correctly, it was like an extended abdominoplasty and bilateral chest excision with free nipple graft. I might be getting some of the terms a
That's
little
all.
bit.
That's all right. So it's basically a breast reduction or gynecomastia excision, removing all of your breast tissue, and then a lateral chest skin excision when we go lateral. That's basically if I'm extending an extra foot on each side, I put a label on that to indicate that it's more than just a a breast reduction. And the free nipple grafts are significant. That's time consuming. That's key when there's no hope of just reducing it some. We wanted to get rid of all of it. And the extended tummy tuck, of course, is very important. And extended just means it goes a lot longer than typical. It's probably 4 times the size of the average tummy tuck. And the way that I do it, I also lift up the whole pubic area in the skin, so it tightens your thighs, it tightens your entire anterior torso and thighs, and made a big difference. But you know, one cute thing I wanted to, you touched on it earlier about how you almost fainted. That's something I've seen a lot of, actually. I learned the lesson the hard way. When we did that TV show Extreme Makeover Weight Loss Edition, we used to do a reveal on day 1 where we'd stand the patient up in front of the mirror with their eyes closed, all the cameras would be rolling, then we would take off the garments and let them see their new body for the first time. Well, guess what? Every single one of them started to pass out there. It was so emotionally overwhelming to see it, and so I'm used to that now. And so we changed it from day 1 to day 3 for the filming because they were a little bit better able to deal with it. But what it speaks, what it indicates though is how significant this moment is in your life. How many things in your life have made you almost pass out? Not many. It makes the bigger, the stronger they are, the easier they fall when confronted with such a transformation. And it's fun to be a part of somebody's life when it's so significant they can barely stand up and maintain consciousness. It's so exciting. So.
Yeah, I will never forget that that feeling and that day. And then just, you know, as it healed, I know someone had asked like how the scars are healed and things like that. And I mean, I actually recently posted a picture from when I was like in my competition shape, which I won and qualified for Worlds. But you can't even see the scars because of the way that you contoured it with the chest muscles. I mean, I will say I was pretty pumped up at the time, but I mean, it just looks.
But that's an important point, though, because I feel like I've really got it down about how to close incisions and make them look good, but it's not always easy. And you had a tendency to have thicker scars. I think I worked on them for almost 3 years. And I mean, I got to know you pretty well because for me, scars are like a war, one battle after another. And I don't want to give up until I win that war. And yours is a really good case. At first, they were pretty pink and prominent, I think, because the muscles were straining them so much and pulling apart those incisions. But you can barely see them now, and makes me very happy with that final outcome. That's for sure.
Yeah, it was when I saw, you know, sometimes I still can't even believe, like, when I see it, and I'm like, wow. Especially when I look back at the photos that you had me take in your office. I didn't take that many of my own photos with all the skin, which in retrospect, I wish I had.
I've got a few to share with you, I think, if you want, from the office. It's, you got a lot of good ones, though, that's for sure, winning those competitions. It's, you know, it makes me, I'm so proud of you, Jordan, and it's been such a pleasure to be your surgeon in this case. You know, this is, for me, what it's all about. I love what I do. I love people. I love being valued by patients who think that I do something special. I love trying to exceed their expectations. I love sharing special moments with them. And I love being a positive influence on them. And look at, your case includes all of those things and then some. Not only that, but you've gone on to inspire so many other people. Every day you're out there as a positive influence on eating clean, on working out, on working through the ton of adversity, many things you didn't even get into in this call. But you know, it isn't easy, but it's easy. It would be understandable if you didn't compensate in such a positive way. But it was really an honor to take care of you. It makes it fun for me. I hope I can do this into my 70s, honestly, because I'm having so much fun. I feel like, it just keeps me going to make a big difference in people's lives, to do something special that I know probably not that many surgeons could have delivered this kind of result that we got in your case. And then to pass that baton back to you as my partner in this, and to have you just exceed all of our expectations, and then not stop there, but to inspire others to have healthier lifestyles. It's just fantastic. We all win in this situation, and thank you for including me in this journey. It's been a special privilege.
Absolutely. I am so appreciative that I came across you and decided to work with you, because that really has changed my life. And I always recommend, anyone who's looking to get excess skin removal or anything really, to always go talk to you, because I can feel good about sending someone, because I know what you're capable of. I know what you do, and I know who you are. And I think that really does make a huge difference. And just the changes that I've had in my own life, like you said, it's like the butterfly effect. It has helped reach so many other people, and it's pretty cool to see that happen. Just from like doing the work and being positive, and just knowing that like sometimes we have to get help. That's just the reality. That's just how it is.
Jordan, this has been really fun, and I wonder, I've talked a bit, and you have too. You think we should open it up for some questions to see if there's anybody out there who wants anything we can answer specifically about your case, about your transformation, and what you did, or the surgical procedures that I did?
Yes, let's definitely do that. Let's see if anyone has any questions or anything that they want to address. We got a few people left in here.
I'm curious, now that you're, obviously really, you pay attention not just to working out, but also eating well. When we do big surgery like this, making sure you have plenty of protein in your diet is really important. It's also important, I imagine, if you're competing in a bodybuilding competition. What would you recommend, based on your knowledge, for people to kind of eat healthy and prepare for surgery if you're into weightlifting and you've got a big operation coming up like this? Any special diets?
I would definitely recommend keeping your protein high. And I think when you're in the action, and so leading into it, I think it's a good habit to get into keeping your protein on the higher side. And then once you have the surgery, and I've actually coached folks for their nutrition who are having surgeries, skin removal or other, and I always recommend to increase your protein, because your body is going to need that protein as the building blocks to rebuild all the cells and to recover. And, it's really challenging sometimes, especially like with the recovery, if you're not hungry. So at that point is when I would recommend to take in some kind of protein shake or even a bar, just to help kind of boost it. But I do think that eating like actual food, eating your protein, chewing it, having it with some vegetables and some, healthy grains or things that work with you is definitely the way to go. But definitely high protein. I do think it really makes a big difference. I think that's what helped me recover even better. And I went into it with high protein, and then I raised the protein and actually lowered the carbs and the fats because my activity had gone down, but I wanted to make sure that I was still eating enough to support that recovery. And I think it worked pretty well. So,
yeah, you healed great.
Yeah.
Really minimal problems. Is there a question?
A few questions.
I see a few questions. So how was the recovery? The recovery was challenging. But, after the first few days, it really was not that bad. And I had a lot done. I mean, Dr. Sugar, I believe you.
Basically, you had the max done. Not
yeah.
Really, you shouldn't do much more than I did that day on you. And it's just because I knew I had done a lot of this, and I continue to do a lot of this, that it was possible. But I would not recommend that others do any more than we did on your particular day. But you're not just a lot of surgery, but you're a big dude to begin with. So, if you come in and you're a 100-pounder, that's one thing. If you come in and you used to be a 400-something pounder, that's a whole different animal. Okay.
Yeah, and I think, you know, the
Pain level,
recovery
was
was
it tolerable? Did you need a lot of opioids afterwards, or were you
no.
able to? Yeah,
Yeah, I remember I did in the beginning need them, which I wasn't expecting to. And I remember you had mentioned to me, you know, I know you have a high pain threshold and this, that, and the other, but you're going to need to take the medication as directed, which I learned was accurate, but it was not for a long period of time. And I feel like, you know, once I started getting a little bit more manageable as far as, you know, a couple days after the initial shock of, I mean, it was a big surgery. There was a lot of skin cut from my
big.
body. So once that kind of initial pain started to subside, I just switched to like Tylenol. You can ask my wife, I'm not a fan of taking any types of
Yeah, that's good.
painkillers or pills at all. So as soon as I could get off of the opiate based one, a couple days after the surgery, I did that.
Good.
And the pain level, you know, it was more of the immobility that was frustrating
Yeah,
because I wasn't used to that. But, you know, I got a chance to rewatch some shows that I liked and kind of hang out for a week. And then I started being able to walk my dog. Ended up adopting a second dog during my recovery because the walking was like such a big thing. And yeah, so the recovery was really not that bad considering how much positive change came out of it. And something I always told myself was, you know, the recovery and the pain, that's all temporary. But the result that I get from this procedure is forever. Like I get to keep
right.
that for the rest of my life. And that's huge.
There are a couple of interesting things about doing your type of surgery. So one is I'm removing so much skin. I mean, really, it was probably 2.5 feet of vertical height of skin from your lower abdomen. By, if you stretch it out, probably almost, I need to get closer to the screen, almost 4 feet long. I mean, that's more than a square yard of skin. And that's before I even got to the chest. One of the things that can happen is usually there are little areas of numbness afterwards. And you tend to get more sensation over time, but that numbness is convenient at first because it doesn't hurt so much. So we use that to our advantage. The other thing is your muscles were in great shape, of course, because you had worked out so hard. So you didn't need a lot of muscle work on the inside, and that also spared you, I think, another aspect of the recovery, both initial discomfort as well as making it easier and faster for you to get back at the gym. So, which obviously is a big deal for you in your life.
Definitely.
One of the things, just everybody out there, in case they're anywhere near your situation, when patients come to me in preparation for surgery like this, and they're not optimized, or still a little bit too heavy, or they're not working out enough, or they don't have the kind of nutritional status that I want, I encourage them to start in that moment, the moment that they meet me. Like right now is when your diet changes. Today, before you go to sleep, is when you're going to work out. And it's like, this is serious. And of course, they have to agree with that, but I encourage them to stop making excuses. They've met me. This is what I insist on. Let's partner now and get serious. Just start doing it right now. And of course, you came in already having done most of that, but you did take it to the next level after we met that first time. I don't really remember that initial, maybe you remember that initial interaction, but did I tell you to lose even more weight and to work out more? Do you remember what the conversation was back in 2012?
Yeah, I remember you basically looked at me, you examined me, and you're like, you're ready to go. But I was still researching, and I actually hired a coach myself, which I am a coach, but I hired a coach at that time to help me just, level it up even further. And then I just worked as hard as I possibly could to get myself in the best possible condition for that day so that I could have the best result. And so that, I went in knowing like I did every single thing that I could do. And that made me feel really good about going in there. Yeah. So, I was in the gym all the time. And then once I got back in, I competed in a powerlifting competition 10 months post-surgery, and I was stronger than I had ever been. So I rebuilt, and I was able to get, to the next level. And I think that was pretty cool to do. I see there was a couple other questions, and then I actually, unfortunately, have to run. But I see
you have to go work out, right?
Right. I already did one today. I got to get another one.
All right. Is there a last question we want to take before we wrap it up?
See. I see someone asked about average daily caloric intake, and honestly, for me, it really depends on the goal. I think leading into the surgery, I was probably somewhere around the 25 to 2,800 calories mark. And then afterwards, it actually went down a little bit because my activity was lower. If I'm getting ready for a competition, it'll be lower. If I'm getting ready to lift really heavy, it'll be higher. So I always tell people like not to worry about what someone else is eating, because it doesn't, my numbers don't have an impact on what anyone else is doing. Each person is unique. Even though it is a mathematical formula and equation, there's too many variables, too many factors to be concerned with that. So I would say just to, everyone has to know or learn or get coached on what's optimal for them, because what works for me might not work for someone else, and vice versa.
Jordan, I think that my smile muscles, I've been smiling so much now, they're getting kind of fatigued. I don't know if I need to work them out more or not, but I'm so proud of you. I'm so happy for you. I'm so, I'm honored that you chose me to be your surgeon. I feel like, I worked really hard for you. I did everything I hoped to achieve, and then you took it to the next level. You're inspiring others. It continues to, all these years later, continues to make me so happy to see you on Instagram, to see you every once in a while when you stop by the office. You've inspired other people, many others actually, who have come to see me for surgery or advice or other procedures. And every time I know, it's just, you're paying it forward. You're inspiring others. I got to be a part of that, and we all won because of it. And keep up the good work and the inspiration. Thank you for inviting me to be a part of this. It's been a real pleasure. I hope to see you again in person soon.
Yes, we will have to make it happen. Thank you so much, Dr. Stoker. I really appreciate it. Probably more than you'll ever know, but I'm just forever grateful. So thank you. And I appreciate everyone who's here, listening, asking questions. If there's anything else, you can always shoot me a message and I will get back to you. And definitely, if you have questions for Dr. Stoker, reach out to him as well.
And again, like I mentioned earlier, check out the links to our Instagram and the story. We've got interviews and other videos to show on my website, all the different pictures and your own personal pictures in your life. It doesn't get much more inspirational than your story. So check it out, guys. Thanks for joining us.
We've got it all out there. So thank you so much, Dr. Stoker.